Well, thank you very much, and thank you to Cereno for inviting me. And thank you for recognizing the importance of the patient voice. Because behind every data point and behind every investment decision, there is a person living with this disease. So, my name is Hall Skåra. I'm actually Norwegian. And my journey started in 2003. I started becoming short of breath. So there was no indication before this happening that I would have a disease like this. So I just started noticing that I was short of breath. So then I was pretty active. I lived very healthy. I exercised a lot. So this is from the years before I was losing my hair, you can see. So this is quite a long time ago. And I went to the doctor and I complained. And I said, I think something is wrong because I'm short of breath. So he took a lot of tests, blood tests and all other kind of tests, and everything was normal. But I insisted because I knew my body and I knew something was wrong. So he sent me to the local hospital. There I did a bicycle test. And to my surprise, I did as well as expected. But I've been thinking about this afterwards, and I think this is because I was in good shape. And when I did as expected, this was worse than, for me, normal, because I was in better shape than normal. So I was just told to go back home. Everything was okay. Continue to exercise, and things would probably be okay. But I started to get gradually worse. And after 2 years more, I realized something is seriously wrong, because then I started having problems going up steps and things like this. So I went back, and this time I met with a pulmonologist. He put a little oximeter on my finger to measure my oxygen, which was normal at rest. But then we went down to the basement of the hospital and we walked quickly up the steps. And then he looked at this oximeter and said something is wrong. Because I had very low oxygen in my blood after that trip up. So then I was sent to the main hospital in Oslo, and that was what I needed. Just after 2 days, they found the diagnosis that I had this disease, pulmonary arterial hypertension. And the reason for this disease, they could not find. So it's called idiopathic. And I was told probably as the years go by, you will see, and the reason will show up eventually. And now it's been 21 years, and still there is no reason. So the reason for this, I don't know. And my first reaction was angry. I was angry at my body because I had treated my body very well. I did everything I should by living a very healthy lifestyle. And this is the response of the body to give me such a serious disease. A life-threatening chronic disease that could not be cured. And I had been reading on the internet, and I knew that if this was the disease I got, it would be very serious for me. And what I read on Dr. Google was that 2.8 years was what was expected after the diagnosis. So, as I said, I was 46 at that point, and I thought I would not be able to be 50 years old. I had a family with 2 teenage sons, and I remember we were in a hospital room after the right heart catheterization. This is how you diagnose this disease. They go in with instruments inside your heart and measure. And we were sitting there, me and my wife and the oldest son, and the doctor came back and he told the diagnosis. And my wife immediately started crying. And I don't know why, but the first thing that came into my mind was, will I be able to be a grandfather one day, to live long enough to be a grandfather? And the doctor said, oh, why not? But then I saw he looked at my older son to see how old he was. So I knew this is serious business. And a lot of people get depressed when they get this disease. We have done some surveys, and about 40–45% of the patients get depressed. And of course, you think about that you're going to die, and you forget to live. So this was kind of the case with me also a little bit in the beginning. First thing I did was I went to the bank and I transferred all my accounts to my wife so that it would be easier for her the day I was gone. And strange things, but for instance, if I was listening to music, then I would think, oh, this would fit well in the funeral. So, for instance, I listened to Bob Dylan and Forever Young, and I thought, oh, this would be a nice song to play in my funeral. But if you know the song, there is a phrase that says, I wish you a strong foundation when the winds of changes shift. So I think I had a strong foundation because I decided at that point that I would accept this disease, and I would do whatever I could to live as long as possible and live with a good life quality. So there were no association in Norway, so I started a patient association. We became part of the large Lung and Health Association in Norway. And then after some years, we became part of the umbrella association, PHA Europe. And I started working more for them, and somebody else took over the Norwegian association. Talking about work, by the way, after my diagnosis, I went down to a 50% position, and after 6–7 years, I stopped working completely. I worked in a large computer company I had a management role. And for some reason, that did not feel interesting anymore. I had much more interest in working and trying to help other people with this disease. And through my work in PHA Europe, we had some unmet needs that we tried to address. And the first unmet need is that it takes way too long to get diagnosed. And the problem with this disease is that you get the symptoms are so diffuse, that you're short of breath. Well, if you're out of shape or if you have asthma or whatever, you're short of breath. And you need to go on the operating table to get a real good diagnosis. So our hope is that we can find a way to diagnose patients earlier, maybe through a blood sample. But if not, we need to help create awareness for this disease. Because today it takes 2 to 3 years after you go to the doctor the first time until you get your final diagnosis. And with me, as you saw, it took 2 years. So these are some of the things we do. So my son, he's an athlete. He played on the national team for Norway for basketball. And I convinced them to play one of their matches with the blue lips, which can be one of the symptoms of PH. So they all painted their lips blue. The opposing team did the same when they heard about this. And this created news in Norway. It was in the papers and so on. And then we were invited to a TV show, me, my son, and my doctor. And then we talked about the disease and created a lot of awareness for this. Another way I created awareness was through a TV program, which I think also they aired here in Sweden. It's called Hva feiler deg? Or what's your diagnosis? And it's a kind of interesting concept. You have 2 teams, One team is a doctor team, and another team have no medical background. And the team without medical background, they can use internet, and the doctors cannot. And then you give them hints about your symptoms and so on. And one of the hints was boxes of Viagra, which is actually an entry-level medication for PH. And this is what I use. I take Viagra in the morning, in the day, in the afternoon. And I've taken about 22,000 Viagra pills since I got this disease. And people often ask me, do you have any side effects with this? Anyway, one of the doctors, he was a cardiologist, and right away when he saw this, he knew what kind of disease I had. But we had a patient association meeting after this, and one woman stood up and said she watched the program. She went to the doctor. She said, I think I have this. And they diagnosed her with this disease. And this is an interesting area because we, as a patient community and the pharma industry, we have the same goal. We want to put patients on drugs as early as possible to make them live as long as possible also. The second unmet need, I would say, is we really need a true disease-modifying drug. Because as we heard today, the drugs are not true modifying drugs. So whenever I hear about a new company, I hear about a new pathway, and I hear the words disease-modifying, I get very excited. And all the patients get very excited. Because then there is a potential that maybe you can have a drug that can reverse all the things that's happened inside your lungs. And as Professor Unmet talked about, there are different types of PH. And you have this type of PH where you have a lung disease, and they have no drugs. So when I talked about this 2.8 years, it's even worse for them. And this is a large group of people. So if you have a company with a drug for these kind of people, you have a big, big market. And then the third unmet need, and this I often see when I travel around to different associations in the world. Many of them, they don't get access to medication. So we are very lucky in Norway, Sweden, and so on with the universal healthcare. But if you go to Eastern Europe, if you go to South America, etc., they don't get access to all the available medication. So my plea to a new company delivering drugs to the market, please help as many patients as you can. So the question is now, after 21 years, and by the way, this is very unusual to live this long with this disease, so I have been very lucky. So the question is, have I become a grandfather? Because now certainly my boys are older. My oldest is 39 this year, and the other one is 35, but they have not yet had any children. But I've told them, you know, there's no worry because I plan to stick around for many years still. And especially when I hear about new drugs, I think I can stick around for many more years. So thank you.